Good morning everyone, my name is Daimi Celis, a student nurse from University of San Agustin. Today I will be going to perform the general procedure for priming intravenous infusion. First, you need to check doctor's order to verify for IV container and note for correct solution, correct rate, and correct frequency. Identifies the client. Good morning, ma'am. Ako gali si Daimi Celis, ang student nurse from University of San Agustin. Today, I will be going to perform the general procedure for priming intravenous infusion. Pwede ko mabala ni mo pangalan, ma'am? Ako gali si Dixel Shane Celis. Ano yung mo birthday, ma'am? April 9, 2013. Ma'am, so bali ang imo pangalan is si Dixel Shane Celis, kag ang imo birthday is April 9, 2013. Ma'am, pwede ko malanta imo wristband. After you identified and explained the procedure to the client, you need to wash your hands. Washing your hands prevents for the transmission of microorganisms. After washing your hands, you need to gather the equipments: kidney basin, IV solution, IV tubing, IV label, and alcohol swab. Remove IV solution from the outer packaging. And gently squeeze. Check for the color, clarity, and expiration date. Note, not all IV bottles have outer packaging. Remove primary tubing from outer packaging. Note for tubing for kinks or obstructions. Move the roller clamp about 3 cm below the drip chamber and close the clamp. Remove the protective cover on the IV solution port and keep sterile. Remove the protective cover of the IV tubing spike. Be careful not contaminate the spike. Without contaminating the solution port, kink the tubing connecting the drip chamber to prevent formation of air bubble. Carefully insert the IV tubing spike into the port, gently pushing and twisting. Hang bag on IV pole. Fill the chamber 1/3 to 1/2 full by gently squeezing the chamber. Remove protective cover on the end of the tubing and keep sterile. With distal end of tubing over a basin or sink, slowly open roller clamp to prime the IV tubing. Invert back check valve and port as the fluid passes through the tubing. Tap gently to remove air and to fill the tubing with fluid. Inverting and tapping the access ports and back check valve helps displace and remove air when priming the IV tubing. Once the IV tubing is primed, check the entire length of tubing to ensure no air bubbles are present. Close roller clamp. Cover end with sterile protective cover. Hang tubing on IV pole to prevent from touching the ground. Keep the distal end sterile prior to connecting IV port to patient. Label tubing and IV bag with date, IV bottle number, time started, rate, and initials. dispose of used supplies. Perform hand hygiene. Prime IV fluids will serve as mainline, side drip, or piggyback.